I'm a board member, but I also have a normal job. I work for the Department of Health and Human Services. I'm a children and family services specialist supervisor. I don't know why we have such a long title, but I supervise a team that does like adoptions, guardianships, older youth or aging out in foster care. But I'm also part of our leadership team for our work group. I'm a co-leader for our work group for the child, adolescent, and youth group. And that's what we're kind of here about today. So I want to thank everybody on behalf of our leadership team for showing up, having further conversations, and hopefully getting to the point where we're going to start talking about some action steps. I just kind of want to remind everybody kind of the purpose of the meeting and why we're all here, but to refresh our collective knowledge from our last meeting. Notes. We're on track. Finally, we want to finalize the list of priority community connections that share activities, actions, and outcomes that will result in a community action plan. That's what we're working on. Launch a work group to address the priorities deserving of our collective efforts. And lastly, discuss how this information will be presented back to the large Buffalo County Collaborative and well-being. Minutes are up there, or they are in your packet.
I don't know if they're up on the screen yet, but they can be, but they're also in the packet.
They're in your packets. So I would just ask for somebody to motion to approve them.
I motion to approve.
Second. Discussion.
Who was the second?
So move.
Well, we may have some people on Zoom. I don't know if you want to just check in
Oh, yeah.
and see who maybe is joined us via Zoom.
Sorry. We can go around. Do we want to do full introductions? I don't know. Quite a few of us. We can do that too. Go ahead and start. I'll throw it over to Jason.
I'm Jason Nowens. I'm the principal of our non-traditional school in town, the Hanny Ram Center for Success. And I'm a leader with Burke. Right, actually, I follow.
Debbie Schroeder, I'm a board member with Buffalo County Community Partners.
Matt Moore, State Coordinator with Buffalo County Community Partners.
I'm Tim Shaver. I'm a semi-retired pediatrician for a few more days. I'm also a board member.
Maddie and Sadi, Buffalo County Community Partners board members. Michelle, do you want to manage the introductions online?
Yeah, sure. It's kind of hard to hear y'all. So trying to do our best here. I know it'll probably get better once you guys kind of finish lunch over there. But Michelle Tucon, Marketing Coordinator here at Community Partners. And let's go, Krista, Nate, Janelle.
Hi, I'm Krista Fritzen. I'm a licensed clinical psychologist, undergraduate psychology professor at UNK, and director of Kearney Campus Behavioral Health Education Center in Nebraska. Also part of the local outreach for suicide survivors clinical team. And my role, I guess, is multifaceted. And I would like to just throw a quick plug, though, if anybody needs any speakers or wants to have any information related to Beacon, let me know. We have some funding to create some programs.
Hi, Nate Dennis with Kearney Police Department, currently school resource officer.
Janelle Brock with the VA Suicide Prevention Program.
And I have Doug, Cheyenne, and Amanda.
Doug Kramer, I'm with the Buffalo County Attorney's Juvenile Services Unit.
I'm Cheyenne with Early Head Start, and I have Chris Counts here in the office with me too.
Amanda Shoemaker, and I am a community volunteer on the board with Buffalo County Community Partners and also part of Royal Neighbors Group here in Kearney.
We have Natalie Hannah, which is an early childhood educator and a family child care provider here in town. And then Lacey, if you want to introduce yourself.
Yes, Lacey Witt, Director of Behavioral Health Inpatient here at Richard Young, and also a member of the LOSS team.
Thanks, Denise.
Denise Sweeter, Buffalo County Community Partners.
Veronica Lupien, Prevention Coordinator at the Safe Center.
I'm Hope Schwartz, and I'm the communications coordinator at the Safe Center.
Janelle Brown, Kearney Area Children's Museum. Megan Andrews with Boys Town.
Penny Parker, Nebraska Total Care, and also board member of the ARC of Buffalo County.
Cassie Kozlowski, Nebraska VR. Libby Harsh, Kearney Public Schools, Sixpence. Aaron Small, KPS, Sixpence. Amy Schulman, Urban Learning Actor and Coach Consultant out of ESB Tech.
Angie Koenig with Royal Meyer Institute, UNMC here at Children's Army.
Alexandra Dillon, Early Learning Expansion Coordinator at ESB and a co-leader for this team. Leslie Martin, Early Childhood Coordinator, Community for Kids. Martha Marciano, Bilingual Clinical Navigator and Wellness Coordinator for Buffalo County Community Partners.
My name is Dan Endorf. I'm new to town. I'm the Director of Student Services and Safety at Kearney Public Schools, and I found out about this meeting about 12 hours ago.
I'm Ellery Butterfield. I'm the new youth coordinator. I'm Alex Richard, the executive assistant at Community Partners.
Wanda Fedorczyk, Buffalo County Community Partners Prevention Coordinator and Central Navigator.
Cam Miller, Behavioral Health Coordinator, Community Partners.
Billy Yellen, Two Rivers Public Health Department, Health Navigator.
Treya Patterson, and the Health, Nutrition, and Mental Health Service Coordinator, oversees the Central Service Area and Start.
We have some discussion about results-based accountability and collective impact. I just kind of wanted to get a sense of everybody's understanding in regards to that. So we just kind of want to have a little bit of a discussion amongst ourselves. There we go.
Nicole and I thought, since the leaders always lead this part, we thought we'd just see if others felt comfortable just talking collective impact. So what does collective impact mean to you? And you can read right from the screen if you'd like. I think it's just practicing that vernacular, right? All getting comfortable talking about why we're coming together. So what's collective impact mean to you? Anybody want to be brave?
Working towards the same goal together.
Thank you, Erin. Anybody else?
Coordinating all of the amazing things that we already have happening so that they're all on the same page.
Yeah. Reducing duplication.
I think the one, I look at this all the time and I'm always surprised that I don't always remember it, but that cross-sector alignment includes unusual suspects. So hopefully you look around the room and there's somebody that hasn't been in your usual meetings at Community Partners. That means we're doing good work. Collective impact. I don't think I had that in the handout, so this is going to be a real test. Maybe the board members can help us here. What is results-based accountability? What does that mean to us? It's our model for measurement. Go for it, Nadia.
Okay, results-based accountability is a new format that Community Partners has adopted for looking at the work that is done by asking 3 questions. First, how many? So you all do events where you count how many people attend, how many packets were handed out. So that's the quantitative. The second question is qualitative. How well did we do? And then the third question, which is the most important, is anybody better off because of what was done? So that's the short form.
Great questions. Excellent. I think the next graphic, I don't know who to ask for, Matt or Michelle, sorry. The wizard behind the curtain. Please stand up. This was our question to all of you. Where are we at in this process? Who are we and where do we live on this graphic? Anybody want to give a stab? Tough question for today. Anyone? Board members are staying really quiet. I can tell by their tongues. Anybody want to say yes? Candy, you're ready to say something.
I don't know if I should say it. Let me preface
Go
that.
for it.
I guess I don't have a total buy-in with what we're doing here because I've been a part of a lot of other collaboratives that are trying to go statewide or are just piecemealing it together, like Unite Us and Help Me Grow and so forth and so on. And I just don't know how this is different or how it's better, how it's more impactful. I'm just trying to wrap my head around how is this not one more thing getting regurgitated in a different format? So I'm just trying to, I don't know, not that it's not great work, but just being honest.
We love honesty, so thank you for putting it out there. I'm gonna guess, just to raise a hand, who else maybe feels a little bit like Candy? A little bit there. So you're not alone, Candy. You do it out there. Thank you for doing that. So as we talk about collective impact and the collaborative work you're doing, the board members who are here kind of looking at that bottom tier, they're the backbone support. I don't know if the board members want to say anything about what that looks like. The backbone support. I'm leaning on Nadia because she's been kind of working on this for a while.
As far as how we support, I think that the biggest part is just trying to put all the pieces together to where it is something that is more of a true collaborative that is created by community members. So the Community Partners Board is representative of all the different facets of Buffalo County community. And so I think as a backboard, we just bring pieces from different areas as a backbone, not backboard, and ensuring that the representation is there and that it is created by community members and supported by community members.
There are a few steering committee members here that kind of oversee the work of the collaborative. Appreciate you're the only one. Well, Nadia. Oh, Aaron. Yes, thank you, Aaron. Tell us a little bit about the steering committee. In your own words, there's no wrong answer. We're all just practicing being clunky. That's okay. Candy survived. She's still smiling.
I mean, I think it's good. We're trying to all get on the same page, so we're not repeating services here and there and everywhere, you know, in different areas, but the same thing.
Kind of overseeing the process and figuring out what best you can do to support this work, right? Yeah. So if we hit a roadblock, that might be the group we would say, hey, we really need more of this, or yeah, maybe. They're still kind of figuring out what they are too, right?
Yes.
Yeah. So we see your work in that big circle, right? It's big, Candy. It is. It's a lot of work, and we feel that way sometimes. Those 4 flower petals, we keep calling them, was really that early work that we did. So this is the themes of the work that we're doing. And that those themes were arrived by people sharing what they felt needed to happen in the community. We decided, we being that, everybody that represents that diagram up there, being the we, that we wanted to launch a work group, pilot it, see how well it went, what we learned. So you're all guinea pigs. Yay! So far it's going well, but we value the input of what we could be doing better because we do want to work on releasing more work groups like this. So we really took that bottom flower petal that says children and youth and started bringing people to the table who were talking about anywhere from birth to age 18 and over for a work group to begin collective impact and results-based accountability.
You know, that the only comment I would have as a board member is, I think, Candy, we've been around since the late 90s. And this is probably the most collaborative organization that I've ever been involved in. As far as you know, their expertise in bringing organizations together and figuring out what we're doing in the community and where our gaps are. And it's not that there's probably good reason to duplicate services when we don't have enough services. So that's part of trying to figure out what we have and are we meeting the needs of our community. And we were talking the other day, it's been 3 years now that we're trying to reorganize. I mean, I think we've been, as a board member that's been around for a long time, the organization has been very successful. But every so often you need to look at yourself. And that's what we're in the process of doing, is reinventing ourselves. We have a lot of history, a lot of things we know we do well. But again, it's reaching out to the community and figuring out what we need to do different so that we thrive the next 5, 10 years. And that's what this is all about. I mean, the board has been through, I said the other day, it's been through a lot. I know our staff has been through a lot because we took their jobs that they knew what they were doing. And now we're just exploding that and trying to figure out, where we need to be and what we need to do. We're still doing things in the community specifically, but this is a chance now to relook at a vision for children and youth and see where our strengths are. That's what this is all about. Where our weaknesses are, where our opportunities are, and then know where we need to focus on. And we may not be able to focus on all of it, but we'll focus on several things that we can do better for our community, for our youth and children.
Thank you. I'm glad I don't have to follow you. Is that Jason?
Go, Jason. You got this, man. I'll just throw in one thing too, and I'll give Jason a second to think. And I can't speak for other organizations or other collaboratives that you referred to. I don't know how they're run, but for those of you who are involved with a lot of those collaboratives, I'm sure that you see areas or places where this could be done better, or my work would be easier if. And so that's how we started this, was we invited all of you to bring us what are those gaps? And so I think that I would encourage you to continue questioning how we're doing this so that we don't become just another collaborative that says they're doing the good work, but really just doing surface type things. We really do want to get to that, how are people actually better off instead of just this many people attended a walk. So for those of you who are involved with a lot of those different groups, I would encourage you to just keep bringing those things to the surface and challenge the group as a whole, because that is our intention.
Well, Dr. Endorf and I in education, we hear this quite a bit too when we have something new that we announce we're going to try and do, and someone will say, well, we did that 20 years ago, or we did that 5 years ago. It's just a new name, when we're like, no, it's actually research-based things that we think are going to help our kids. So I understand where you're coming from, Candy, because I hear that every once in a while from staff members, but we usually try to explain to them why we're going in that direction and what benefit it's going to give them and our kids. So kind of a piggyback off that. All right, I'm ready to go if you guys are. You ready?
Let's do it.
Okay. If you look in your packet at the kind of the chart with the cone and the strengths and weaknesses and threats that we did last time when we were at the Arong Center conference room. That's when we broke up to those groups, 0 to 5. I think we did 6 to 17 and then 18 plus. Did we combine somebody though? Did we have 4 and we combined the 3? Yeah, that's what I thought. Anyway, if you look in yellow, those are kind of the things we hit on as things that we were hitting. You know, the burnout as a weakness, the stress for families, the stress for employers and community was one thing that resonated with me from the last meeting. School and childcare, having problems finding childcare, parent support, all that on the 0 to 5. You know, and then we look at opportunities, and we always hear how other countries are doing so well with their education system or with their mental health care system, and, you know, paid maternal and paternal leave. Sweden was in there. International in-person programs aimed at creative outlets finding balance for screen time and real time. It was amazing. I had a friend who's a teacher at Kearney High sent me a picture the other day, and he goes, "Is this 1985? And there are 12 bikes in his yard, and all his son's friends were over and they were playing in the backyard." I'm like, that is wonderful. I love that. You should post that somewhere, because that's the way it used to be. That's where my mom knew where I was, because she drive by and see my bike, you know. So anyway, if you look at the 6 to 17 page, truancy, you know, accomplishment we had was truancy issues. At the Aram Center, we had a lot of kids come to us last year that were on truancy and had major gaps in their education from missing school, and we worked really hard to catch them up. Hope Squad being at UNK, Kearney High, and Horizon. For those of you that don't know what the Hope Squad is, it's a evidence-based program with mental health and suicide prevention in a peer model. So kids at UNK that have been trained in the program will have a green bandana on their backpack, and basically it's a sign of, if you're struggling today, I've got some information for you where you can get some help. Would love to see that spread even more in the community and the county. Speaking of that, make Buffalo County more inclusive, not just Kearney, but other communities as well. Threats, it's the age-old thing of lack of family involvement. We're always thinking of ways to get families more involved. Turnover rates that are high in all our fields. You know, if you look at where you were 5 years ago to today, and how many people you know left the field that were tired, or they were frustrated and things like that. And then the 18 plus, you know, the Kearney Bound program helping first generation college students is an amazing program. I used to be a part of that when I was a counselor at Kearney High. So kids who had parents who don't have a bachelor's degree were eligible, and it's neat seeing some of those kids now that have graduated because of that program, and they're out in our community in the workforce helping our community become even better. Budget cuts, transportation, you know, all those are tough. I think I've said this before, but when I was in Lincoln at North Star, one of the things that always amazed me was that all the kids came to North Star that didn't have a ride rode the city bus. And every high school in Lincoln had 2 bus stops next to it. You know, I know we're smaller in Kearney. I just wish we had something like that here that could transport. And I know our school system has a bus service, but you know, it doesn't stop at every school and things like that. And so I really was impressed with that at North Star, just seeing city buses dropping off loads of kids at school. Opportunities for prevention, funding for COVID programs, and collaboratives that have met community needs are all opportunities we have. So I've gone through my 5 minutes, sorry. That's what happens when you give me time to think.
I know. So the leadership team took the work that you did at the last meeting, and with the staff of the County Community Partners, if you look at the next handout, we identified what we're calling connections. So we tried to look for common common aspects, and we identified at least 5. So now we'd like to take a minute and please think about your work, and as was stated previously, what are those areas where there was some support or additional effort placed, your work could be done better, more effectively, and more importantly, what areas are we capturing the right areas where we can make a difference and people will be better off? So if you look at the first page, the format of this is parent education, family involvement, and then we pulled what we identified from the grid that seemed to support that was an area of connection. These areas of connection are still very broad, so there's more work to be done, but this was a place for us to start where we could begin then to have a sense of what actions we might be able to take. So what we want, as you look through this, is next we'll talk about your agreement and what's missing or what needs to be added. So the first is parent education and family involvement. Give you a minute to just read through what supports that connection.
Those items in yellow are what Alexandra and that leadership team pulled from the other matrix you just looked at. Those highlighted things are coming across.
On the second page, and we'll talk about these more next, but this is just to give you a kind of a sense of how we got them. Workforce, education, childcare, mental health, and those caring for children.
I think those of you who have handouts, I think we lost all of the back sides of all of your pages. So if you're wondering why you don't have workforce, there's no copies in this room. So you'll have to look at the screen.
Okay, so I'll just read this quickly. First to 5 years, stress for employers, burnout educators, employers' flexibility for work-life balance, childcare staffing and turnover, low childcare pay, parents not returning to work due to high cost of care, more maternal and maternal leave. Ages 6 to 17, these were highlighted on the grid. Lack of rural service, Hanier Center limited to serving Kearney, high turnover rates, low paying positions in the helping field. More support at KPS with social workers and allowing outside supports to come in. Short on mental health providers, staff capacity, open positions that remain unfilled. And then in the 18+ group, they identified hybrid option for learning or work, staffing, burnout, mental health practitioners available, workforce capacity. So all of those thoughts and comments seem to be consistent with workforce issues. The third one was technology, bridging the gap. And in the birth to 5 years, you can see on the overhead as well, social emotional impact, parent education on risks, the importance of being placed, education on screen time, including school. There's a huge significant jump in how much screen time. That goes to the next page, which you probably have in your handout, which is age 17 and 18+. And I'll just be quiet for a second and let you read those. And then number 4 is another broad category, mental health and difficult behaviors. And what we identified from the grid that seemed to support that category. So I'll be quiet, make sure that your items are on there. The last is number 5, access to basic needs. So now that we've kind of oriented you to what we did with this item that Jason described, I'll turn it back over to Nicole to talk about how we.
So take a look at that, and what we want to kind of talk about and have some discussion around, we're going to use a Jam board, kind of throw out anything that we feel like we're missing. We just want to make sure that, I know we've had lots of discussions from the past kind of about this, but we just want to relook and make sure nobody feels like we're missing anything that might fit into some of these broader categories. Feel free to just shout
We
it
are
out.
getting copies, so you have everything. So hopefully by the time we get through the parent one, you'll have copies of everything.
Something that comes to mind for me is just housing. Is that affecting? Because I feel like that might be something.
I see that a lot.
So describe that a little bit more. Access to housing? or-
Access to affordable housing.
Okay. So we put that on the house or on the access page. While Matt's doing that, other ideas? You want to take it with parent engagement first? Is there anything else you think? is missing? I can read to you too what I saw on parent engagement while Matt's working on that. Somebody, because we asked people just very briefly about 24 hours ago to add what was missing. So some people have put burnout from COVID and the political climate under parent education, family involvement. Parents is part of the solution, so having parents part of that conversation and solution. Parent education in other languages was another thought that they saw was missing, and the importance of culture as an element of prevention efforts. So just knowing what our community culture is to help with prevention strategies as well. Anything else you see missing with parent education, family involvement? Something you felt strong about last month that you don't see here? It's getting arranged a little differently. The leadership team's working on just bringing in some prioritization with your thoughts.
So one of my concerns is parent education is very broad.
The title up here. We're gonna get to that, Dr. Schaefer.
What's that?
We're gonna come to that.
Okay.
Yeah, we're gonna get there. Okay, so let's move on to the next one then. I know you don't all have that page in front of you. This is where we're gonna be a little bit disadvantaged without. If you have it, I know some of you actually have a complete copy, so if you want to share it with your neighbor. Anything missing on the workforce? What we've heard so far from others that have plugged in the last couple of days is 18+ years of age, lack of mental health providers in Sandhills and other rural areas, plus lack of transportation for people to drive to get to services. That's a rural health, mental health for 18 and older. Voices of business leaders and economic development, since this is a workforce issue. Anything else workforce related?
I don't know if this is appropriate to bring up here, but Medicaid expansion, we still have a lot of people in Nebraska that have not applied and would qualify and may have access to mental health services. I know that providers is an issue, but sometimes knowing you have health insurance is a barrier too. So there does need to be some additional education to families, especially low income or gap families, to apply for Medicaid expansion.
I would definitely agree with that. We have a lot of clients come in and I'm like, well, we applied for Medicaid and they're like, I was denied, and they don't recognize that when that expansion happened. So I would agree with you.
And if they are denied, it'll kick it over to Marketplace, which are affordable options if their employers are not offering health insurance or they can't afford what's at work. That could be, you know, higher fee needs if you can take care of one of those.
So is that like the understanding of Marketplace or what that could offer people?
Probably health insurance.
Sorry, Matt.
I think Michelle's helping me out a little bit,
It's me.
just as well.
I know you just don't know who's behind the curtain, do you?
No, for the workforce for childcare, low pay, they're below poverty. So recruitment and retention is horrible right now.
I think that was in that work group. That was pretty prominent conversation, wasn't it, in that work group? That we had that answer.
No, I'm sorry. I was just. We identified what's missing. My bad.
Next one, Nicole.
Technology. Kind of bridging the gaps, things that we're missing. As far as when it comes to technology specifically.
So Some things that people dropped in there was information available in Spanish, meeting vulnerable persons' needs for technology, and how do we stop the misinformation spread through social media about our programs that help families such as schools, libraries, and programs for youth. Very good one.
As it relates to use of technology, I think it'd be important to add parents as part of the solution to this one as well.
Making parents aware of how much time they are on their screens at school. Part of that.
Yeah, that was very prominent
I
conversation.
think one of the conversations that I heard yesterday was sustainability of our technology, like MyLink is not sustainable the way it is to keep it updated. We have to find a different solution.
Well, there's 1,000 different online resource repositories, but like Dr. Schaefer said, it's a full-time job to maintain all of that, to make sure it's current with all of the turnover, the funding sources. Things change constantly.
I have some thoughts on that when we get to action steps. I really do. Not that that's a no, but I do have some thoughts. After I've been through a few of these and I've asked Candy like 6 times, will you put this on one more forum for people to access? Okay.
Mental health and difficult behaviors. It has quite a list.
Thank you. So that understanding of how trauma affects childhood development, education, learning, and how childhood trauma affects adulthood. School systems need more training on understanding trauma. So a lot about trauma-informed care, trauma-informed communities, the whole age group there. Multilingual mental health providers and youth and adult connections to build strong families. We hear that a lot in our youth group. The youth have different outlook on mental health and behavioral health, and we as adults don't always hear what they're saying.
I don't know if this fits there, but play-based learning.
I don't think that was on the original list that you had.
Well, I mean, it was worded a little differently, I think, but.
Okay.
Because we had intentional and for in-person programs and the creative outlets, finding balance screens and real play, which would be play-based learning.
Thank you, Mr. Henson. Now that everybody has a sheet with all your copies, signs on it, you can kind of reference that a little bit.
I would say overall lack of mental health providers, not just multilingual, but yeah, there's, I mean, some places are having to call their clientele that are on wait lists and tell them they won't be able to see them.
I think sometimes the convenience of it too. I mean, not that I want mental health providers to work at night, but it's difficult if you have a job, school, whatever else to do a daytime appointment. And flexibility of employers.
Yes, and the schools, because oftentimes the families get a lot of negative feedback from the schools by pulling their kids out for their mental health needs.
Yeah. I would say access to services more preventatively, like from a provider standpoint who works with more kids in the system. I know we had a conversation about system last time, but the juvenile justice system, child welfare, when those parents are struggling with behaviors and they become a part of that system, they're able to access a lot more services than they would be able to access outside of the system. So making those services accessible more preventatively.
I had a comment about, my son, he's a senior at Kearney High, and I feel like in some cases, what he's learned, social emotional learning or whatever, has surpassed the capacity I had as a young mom. And it just made me wonder if we have kids who are maybe beyond their parents and struggling dealing with parents who haven't caught up to them in a mentally healthy state. Does that make sense?
I don't know how to put that on a sticky note.
I think that falls under parent education.
Yeah.
I mean, a lot of the tools that kids have been in programs
Way
that
to
they've
get
been
those songs
exposed
to mom and
to.
dad, or
Yeah. So exposing parents to some of those programs.
Understanding of mental wellness.
Is it an access problem, or is it we just don't have it?
I think it goes back to parent education. You know, I won't talk about it since we're going to talk about it later.
I think that elementary and middle school levels send, like, they send home the lessons.
Yeah, they do. They email out
Yeah.
such the second
Yes.
step lessons at those levels, but not.
Right. I can't remember, it's elementary, middle school.
I know it's at least elementary.
Or at least they did. We don't know if I've seen it this year, but.
That says this is what we're working on this week at our school, like, here's our goal, reach out to 5 people we've never talked to before and give them a high five.
I'm talking about the second step. We were.
The elementary, I know, but I don't
We were
know
getting
about
the actual lesson that the kids were getting.
Or maybe that was more peace.
Maybe
that was more peace than
cool.
school.
I don't know.
Yeah, maybe.
But that's also a barrier under the parent education piece where certain cultures or families don't use technology. So if that's the only form of communication or the main form, a lot of families are missing out and they don't know what's going on.
We do a lot of work, like MBR, with a lot of different cultures in like the Lexington school system. I know that Kearney isn't as diverse as a community as Lexington, but just that information that they've had to start putting it in language of that family and their culture. And you just kind of see like with the public school system ones here, it's just English, Spanish, kind of assuming those are the only 2 languages our family speaks, so reaching those cultural diverse populations, you know, that's kind of everything.
I'm hearing some duplicated thoughts from last month, so should we move on to the access?
Access to basic needs.
Adequate dental care for people accessing Medicaid, just the providers that will accept them. There are some in town, but it doesn't seem to meet the need.
Dental is. Yeah, I know we have state board kiddos, but we have sent 3 hours away to have a dental appointment. That's obviously not conducive with school days and things like that, but it is atrocious, frankly, specifically dental. We don't have, physicals are usually pretty good, and vision is a little better, but dental seems to be a barrier. Like I said, it's not just Kearney, it's surrounding, like I said, we had to get a kid in to have a dental appointment, just a checkup, it's then 3 hours away. So,
And that's pretty specific to Medicaid.
yeah, yeah.
What I found this piece interesting too is the leadership team was looking through what you guys had put together last time. There were only a couple of pieces in this, which is more of like access to formalism and foods and just like basic needs. But they felt strongly enough that we needed one more category up here for access. It was nice to see that one more thing arrive. I think it's important.
I would just share that how the access to basic needs affects everything else. I know it's a small piece compared to the other like conversations that we have, but I think it's so basic. Like we don't have access have small groups, but it's kind of hard to see that when it's such a small.
Yeah, and the overlap from when you were talking about access to materials in other languages, you know, just some of those basics and access to internet, some of those basic things, I think. The overlap of not enough providers, so accessing mental health is sometimes challenging because there's not a provider in our area. So.
And I don't know if we want to say access to internet specifically.
Yeah,
Not a basic need, but in today's world, it almost is, especially for children, and education.
You know, one thing we're running into is when we do the resources in multiple languages, even when we do it in multiple languages, there's different dialects.
Yeah.
And Maria, who speaks Spanish, she even has problems talking to some Spanish speakers because the dialects are so different. So I think that's going to be one of those that's up and down. We're going to catch some of them and we're going to not catch others because we don't know their dialects. And I think that's why it's so important to build the workforce up for all kinds of different languages and whatever. So
I think in addition to language, that it's important to include literacy. We talk about medical literacy, it's just the translation is not enough. You know.
That's an issue we're running into a lot of Head Start, is that we have a lot of families that don't have a very high education level. And so we give them resources and resources and resources, and they go in the trash because they don't understand it.
I think I just did a training too, just going through bridges of poverty. A lot of our systems, our school systems, our work, our just education is at that middle class level. And I think a lot of the people that we serve that struggle aren't in the middle class level, they're at that poverty level. And so understanding where we're coming from in our systems and our pamphlets and all that kind of stuff isn't meeting their needs because that's not the level of that. We're not communicating to them at their level of where we need to be to help them understand. So that poverty is a huge issue.
Do we have a review of materials? So that it's not like for Medicaid, we are required to have everything at 5th grade reading level. Like, is there a standard for stuff going out by agencies in town?
I think we're having problems just getting everything translated, whether it's, I'm in a health literacy class, and I'm also on a program through, I never say it right, National Association of Health Directors. I'll say that with the acronyms, I get it wrong. We are working on that among those different agencies, but we're still running into the translation issues. And there, there's no funding. I had sent something in, we had somebody's marriage license that needed to be translated in not Spanish, I can't remember what, but maybe Persian. And it was going to cost $1 a word to do that one thing, but we couldn't get that person Medicaid until that was completed. Now, a lot of them like Burmese, Thai, I can't even remember all of them. There's like 3 or 4, but none of them are for what we have in our area. I can't get something in Somali for less than $1 a word. And we just don't have the funds for it.
And I'll just echo that in Nebraska Department of Education, Office of Early Childhood just has translated the licensing required training for child care providers just now, as those just in Spanish, just in Spanish only. And again, the literacy level, I don't even know what level it is, but so it's been a cost issue and a time issue and finding people who can translate. So.
Are there language classes or just regular people? So like, let's say a
family moves here and they speak Somali, they would like to learn English. Do we have a free English class? Or for me, who works with a lot of communities that speak Spanish, I don't speak Spanish. Is there an option for me to learn Spanish at a free or low cost place in Buffalo County? I don't know.
So the community college does your ESL classes.
Okay.
In what languages?
Well, so you go to ESL in your own language and you're there, it's all spoken and everything's in English, and they're there for them to learn English. So they don't speak the language of the person that comes to the class. I don't know how it works, but you just teach the class in English.
Okay, so we have the option for them to learn English, but we don't necessarily have for us to be learning Somali or Spanish.
I think CCC offers Spanish.
Yeah.
I think they offer Spanish, but they're not, neither are free.
And that might be something that I'm element to work on.
I think we added this category. I feel like we added a lot there.
There were some things missing there, I think, that were important to talk about. Should we transition?
Yeah, I think so.
This is a part that we wanted to go back through these 5 areas, so let's get back to the parent engagement. This is the piece, I think, where Dr. Shaver was going to see. So what our hope and intent is at this point in this process is to frame number 1 a little bit more. Give us kind of a definition of what that is.
Can you just do a check with the group? Do you feel that these 5 are connections that represent the work that was done from the grid? Is there any, are you in agreement that we have work to do to get these even further fine-tuned? But are these 5, so are you in agreement that that represents the work that was done yesterday? Seems like
It was kind of yesterday, yeah.
I think so. How about the people on Zoom?
Michelle, we're checking in the Zoom to see if there is agreement on those 5 areas. Maybe a thumbs up from your team. Yeah, we can't see all of you, so you're gonna have to holler at us, Michelle. We need at least 6 screens in this room, appropriately hybrid this call.
Yep, we got a few thumbs up, Denise. Thank you.
Michelle. Good process stop there. Thank you, Alexander. Let's go dig in. Dig in. All right. So when we talk about parent engagement, family involvement, looking at the conversations we've had to date, how would you word that shared connection? What are we sharing? The shared outcomes, the shared agenda, the shared actions. How would you word parent education and family involvement to capture your conversation? So if you have your parent engagement or parent education piece in front of you, just kind of looking through some of the things that are highlighted. The things on the screen that we added was parent education in multiple languages, parents being part of the solution, family involvement. How would you like to word the shared connection that you guys are all talking about? Anyone from the staff?
Would say providing opportunities for parents, and I think it's education, engagement, and even like I just heard Penny share about, you know, maybe our children are surpassing our parents, so maybe even growth. And we're talking about this.
So I think what Michelle maybe typed, the wizard behind the curtain may have typed, providing opportunities for parents in education and engagement. Matt typed that. I'll better look on his face.
Maybe early parent education.
Early
I
parent?
said early parent education, no, they're not parents. or possibly not
I
parents.
mean, like preparing young adults.
Yes.
We had a lot of
Because
before
to maybe
parents.
stop that generational, like,
Yeah.
they're learning early from someone else instead of their parent as an example, but their parent is not necessarily,
Breaking the cycle.
yes.
So
helping
early
break the cycle.
opportunities, earlier
Yes.
opportunities versus early parents.
Yes.
And maybe we should think about the word parent.
Yeah, just families, caregivers.
Is this to be seen by us or by the public?
First with you. Until you're comfortable sharing with others.
I just am like, I'm imagining how a parent on that side would receive that message if it said breaking the cycle. I might be like, I'm not reading that. You know what I mean?
I wouldn't word it that way.
Yeah.
I'm just explaining why I'm saying that
Yeah.
early education piece.
I just want to be sure,
Yeah.
knowing we're viewing this.
And I think as a parent, education, engagement, I almost like support or even partnership or just something that makes me feel more included. Engagement's okay, but I feel like that's our language.
And that's part of the solution, right? The parents are the hero of this work. So support and use a better word than I did, Wanda.
I said partnership, but I don't think that's the right word.
We've used some co-design, we've used that word, co-designing opportunities or co-designing the work with parents.
So you want to use the word providing or facilitating?
Are we the ones providing or are we the ones facilitating the opportunities,
I
early
think Buffalo
opportunities?
County Community Partners is facilitating, not providing.
Yeah, but it would
The
be.
rest of you
total
around the
group,
table.
right?
The rest around the table, provide.
Would be providing.
Maybe it should say facilitating and providing. Like this, you know,
Concern about
Dumb
the
it down.
level of literacy.
Yeah.
I'm a big concern about the level of literacy, just in that definition, what the site conversation was.
Okay.
I don't think co-designing, I don't think people are gonna understand that.
So we are maybe connecting versus facilitating, connecting and providing early opportunities for caregivers in education, support, partnership, and growth.
I like that.
I think though, just partnering with caregivers for growth. Or, you know. It's great, that's what I'm.
Partnering with caregivers for growth.
Okay, so my mind goes to caregivers because I work so much with child care centers as child caregivers. So I'm like, if you could maybe put caregivers.
Or parents slash.
Yeah,
caregivers,
something,
or-
because I'm thinking child care.
Families.
Yes, we do. Yeah, but somehow families.
I'd really like families.
Yeah.
Partnering with families for growth. And see, my mind, I'm just gonna tell you, it goes a whole nother direction, because a lot of the resources that I use for a husband with brain injuries is what you guys use for caregiving for children. So when you say caregivers, I'm like, oh, that helps me, but I know it's gonna be targeted towards kiddos, but it still is the same kind of process I can use as a caregiver for someone with a brain injury. So I like families.
So we're going with the short one?
Thank you, Oz. Do we like that for now? Yes. Okay, our first draft. Good job. At this point, we were gonna just ask a couple questions. So could we name 2 or 3 action steps we could do in the next 6 months as a group to partner with families for growth? What would that look like?
Something that I've started talking about in my area because of the concern around technology, and we are already know, the research shows we have developmental delays in children that were born during COVID, is to stop just providing education to childcare providers and to start having parents and providers learn together. So that's something that in terms of the work that I'm doing, I feel like that connection has to be made now. Otherwise, these delays are not gonna begin to be addressed in just one environment. So I don't know if that's the kind of thing. So part for me is partners and childcare providers learning together.
So if we could get even more specific, what is one step we could all take together in the next 6 months to make that happen?
I'm trying to bring in a speaker to talk about executive functioning and getting any personal, I don't, we're gonna have food and we'll have to have childcare. But it's the personal contact that you have with parents. If you would say to a parent, this is a session I'm thinking I might really appreciate, that could make the difference. Because right now, parents aren't reading, nobody's reading any communication. It's the personal.
And I think in like a general sense, I have 3 children, I know screen time isn't great. But I don't know like all of the detailed research behind that. So a session like that, even for me, would be extremely helpful. But yeah, I think you're right, with the personal relationship, sharing that kind of stuff. And
One of the things that I'd like to bring up is that I'm personally, being a dumb old pediatrician, feel that parent education and doing the right type of parent education, in other words, what are we going to focus on as a group? What makes our kids successful? 2 or 3 things when they get to school. Tell me.
Wait, to be able to wait and take turns.
Exactly.
What was that?
Wait and take turns.
You've got it, in other words, control. Self-control. So let's take it down from executive function to self-control. So people understand. That's one of the most important things we can teach. Okay. And you're also teaching parents at the same time, for me as a parent, how I self-control myself so they don't model poorly for my kids. Okay. What's another one? And you mentioned it, literacy. We've got to teach them skills so that when they get to school, they have some idea what's going on. Because we know if they get to school with self-control and some literacy skills, they're going to be much more successful. What else?
Most kindergarten teachers, I would hope, would say we just want them to have that social emotional skills versus a literacy skill.
And I would agree with you that that is very important, how you get along with others. So maybe there's 2 or 3 things we need to make sure we're teaching.
From a parent perspective, early childhood attachment, those of you that work with families with trauma, that if that disruption, it just throws. If there's an attachment with the person in their life, that's the foundation of social emotional. So then and the attachment is a word that may not have a lot of meaning for different, but it's about that bond, that connection, that safe base. And these 3 women right here, when that's not there, nothing else will happen. No learning can even take place. And that's what fills the prisons. And we have so much opportunity between birth and 3. If there's the ability to bond and have a secure attachment, that's the highest return on investment. We have data that shows that. That's the highest financial return on investment, 0 to 3 in attachment. Yes.
Is there any information that's given out when you have a baby?
Yeah, I just want to grab a hold of the attention, like grabbing air. What I wanted to say here is I've got 2 things. That's all I asked for, right? 2 things. Because I think we can dig right into action because we love action. So the two things I captured is parents and providers are partnering together to provide some type of education. And then this group will decide what that focus should be. And then I put down here the attachment, the executive functioning, self-control, you're kind of having that conversation. And then over here, I just typed every word you started saying. So it's gobbledygook. It needs more conversation, but I started typing because you're using different words that I think mean the same thing, but we need some time to process what we're all saying in a level that's easily understood.
I appreciate that. What you're looking for is let's prioritize.
Right, but I think there has to be, I mean, I've been involved in many parent education courses. But there's certain things we need to focus on that's science-based, that really has results. The second thing is how do we motivate parents to do this? You know, I've often said that everything we do in life, the one thing we don't have training for is to become a parent. We don't have anything in our, we don't have very much in our school system, do we, that teaches you how to be a parent? Because we don't want to talk about it when you're in school, not until you're 22.
Honestly, that was a college thing. I went to college, went into early childhood. Two of the most important classes I took was nutrition and human development for my parenting. And most people are not taking those classes. Let's offer them at the high school level. But
Well,
nutrition
even
and
like-
human development.
So I went, it's been a couple years ago, but I went through Circle of Security class about bonding and attachment. And I'm like, oh my gosh, I've missed the buck. My children are surpassed this age. And I had all these questions like, I failed as a parent because I didn't know this. And that's sad because I've worked in child welfare for 17 years and my oldest is 12, and my youngest is 7. But them early years are so important. And I'm like, I wish I had that opportunity. I just wish I was more educated or had better access to that.
And
Okay, I'm gonna move us forward.
Sorry.
the motivation, let's just hold motivation. I think that's important to come back to when we are having further discussions, because I think that's really key is what for the parent, it's the why do I care?
Can I comment on the number one, the parents and providers partnering together?
Can I?
You might not have parents with any provider.
Yes, and then I'm going to step back for a minute and walk through the process one more time because I don't want anybody to feel that they're not being heard. But once we get through and name at least 1 or 2 possible action items, we're going to come back and prioritize, right, leaders? And we're going to pick one of these 5 areas. So I want us to have at least some idea of what this 1 or 2 things are going to be before we start prioritizing, and then we're gonna really dig in and we're gonna figure out how to get into delivery rooms and how we're gonna do some of these pieces. We can't solve all these issues in the next 20 minutes, so. If you're okay, I know you love action, I get it. Nicole, can we move forward to the next one? Are you okay with that? All right. I tried to capture everything you were saying because we don't want to leave it behind. All right, what is the shared connection that we want to make sure we say around workforce? We talked about workforce in education, childcare, mental health, overall those who are caring for children. So what's that phrase that brings us all together, the conversations you've had so far?
There was a comment from Zoom on the previous, it said something about workforce. Did it have something
I'll
to
go
do
back
with
and
the
look at
first
it
one?
while you're thinking.
I think it says.
This is Amanda. I think that might have been my comment, was when people were asking about the opportunities, you know, what are the primary opportunities or needs to teach? I think about solution orientation. So problem solving from a workplace needs perspective today, one of the greatest needs is strategic thinking. And there's a big gap in especially youth and young adults that don't have strategic thinking and problem resolution skills. So that was something that I thought of, was starting very, very early at problem solving and using creativity in that.
Thank you for sharing that, Amanda. What's our phrase for workforce?
I'm not sure. I don't know if I understand what you mean by phrase, Denise.
But we just did with slide one, right? Your slide one was partnering with families for growth. So now we're looking for that same language for issue number 2, what captures workforce. What captures all the conversations we've had around workforce.
Building workforce capacity.
I think there's something too about the difference between adequate workforce capacity or efficient. I don't know what that word is.
What does quality mean in schools? Quality workforce, is that a word we use in schools? I'm just curious. We use that a lot in early childhood. So sure, not saying that.
Yeah.
Building quality workforce capacity.
I don't know if I like the word capacity.
I was gonna say, either we need to add to it or get rid of capacity, because I think we're talking about more than just quality of the workforce and that capacity, but also like that environment, like burnout, things like that. What's causing it? What are we doing for self-care for our employees, things like that.
Well, we could have a quality daycare or childcare provider who's being paid $9 an hour. That's not supporting them.
So maybe it's building.
So we're taking capacity out.
Sustaining would speak to retention. So maybe.
Supporting, yeah. Building, supporting, sustaining.
How about a quality career workforce? I work with our kids a lot on getting jobs, and a lot of our kids may not go to college. So we are trying to get them to start looking at the world as a career. So what can you go get a career in and not have a college degree? And I think we focus so much on the college degree workforce that we're neglecting that other workforce. So, you know, I can have a kid making really good money right now at a fast food restaurant. And then I talk to him about when you're 30 and you have 3 kids and a wife that you're providing for, what will you need to have to make that happen? And so that's where we look at other options in the community that they could work at to provide for themselves.
I think you just elevated the work that I've seen in early childhood working on, because you just elevated the work that they're doing as a career. And I think that's the one thing you keep trying to really get people to grab onto. Building and supporting and sustaining a quality career workforce. All right, it's a good draft. 1 or 2 action items we can do in the next 6 months. We are at the last 10 minutes. We've got 3 more to go after this, so just kind of giving you a little time.
So I just have a question for that. Do you feel then, because I think Kenny's comment about, paying a childcare worker $9 an hour, are we able to then convince employers that they need to bump their raises or their bump the pay to be above poverty level, which is higher than $12 an hour now? If you make under that, you're still in poverty. So how can we, so my action step is like, how can we focus on that?
I think if we're talking childcare, I think they know that they are not paying their staff enough. They can't.
But I think to answer your question, to give an example, like Erin and Libby, what is one thing that we're working on in early childhood to help with that?
Recruitment and retention.
Working with economic development council. Businesses in the community to understand that their role is important when it comes to early childcare and how we can continue to elevate the inequality, I guess you would say, in her pay.
I don't think the community or the workforce understands that the cost to provide quality care far exceeds what they're charging their families. I mean, the cost of an
So
infant
we
is way above.
We need employers to come behind parents to help support these childcare providers, to be honest.
So I think an action step, I agree with you. I think an action step is Leslie there's a workforce survey as part of the Communities for Kids initiative right now that's going out to get data from managers and companies on a lot of information around their childcare and how aware they are of childcare as a barrier to retention and to hiring the people you want, et cetera. So, I mean, that's something that's in progress right now that we give this group a lot of information as it relates to the perception of pain that employers feel in terms of childcare being a barrier to their economic growth, which would help with the conversation in the community about the value. And hopefully employers that in other communities have actually started to subsidize childcare spots. So that their employees have spots. So I think once we have that information, I think we're on our way in terms of elevating and helping us employers understand what the cost is and that they're really not even covering their costs.
I grabbed, I think, what I heard you saying, that you want to understand where the employers are at this conversation. You have some data. We need to understand what's currently happening. There's a lot happening. Not everyone around the table has the same depth of understanding that some of you who are sharing, and we need employers at the table. So I grabbed you to those and keep us moving because the leadership, I'm going to say this, the leadership wants to get through all 5 of these and have some action steps so that you can prioritize. So I'm going to keep you on this task. Am I correct, leadership? Okay.
And
So
I
if
need to
we're
run-
moving too fast, you
I need to
have to
run
let
to
me
a
know.
2 o'clock appointment just to slow you down even.
Thank
But I
you.
can feel the care and the compassion in this room. That's mesmerizing. I really appreciate it, and I'll be back.
Thanks for joining us on the 12-hour notice. We appreciate it.
You know, I did the math, and it's probably 18.
All right, when you talk technology, what is that shared connection? Anybody want to throw one up there to start? We would take one from the Zoom room too.
Understanding the impacts.
Kids and parents both being on it, understanding that.
I think there's not just impact, but negative. I mean, there's threat, risk, adversity. You're trying to communicate that there's the risks of technology.
When I think of technology, I think of ease of communication.
It's like understanding that technology is communication.
Well, it's a tool that can be used for very quick, clear, concise communication. So whether that's with your parents, versus not using technology when you communicate, think of the amount of time and inefficiency potentially.
Understanding that technology is a communication tool, effective communication tool.
May or may not be.
May or may not be. That's your positive and negative.
Maybe that's effective use of technology. Effective use of technology.
I like what Amanda's saying though, because she's saying it is communication. If we go back to Jason Mundorf's note that we all read recently, what he's saying is kids need to communicate, right? But if we look at technology as bad, then we're saying you can't
I don't want to be
communicate.
misunderstood that way. It's not bad, it's balance.
Right.
And how do we, it's a very appropriate and helpful tool in schools if it's used in a specific way. So it's not, I would hate for people to think bad, then nobody will come to anything to learn about the appropriate.
Right.
But at the age of 1, 2, 3, 4, 5, a parent sitting at a restaurant or taking their child to the grocery store doesn't go, entertain yourself. No. Teach them while you're going to the grocery store. Talk to them while you're sitting at the restaurant.
can it be more like tips oriented? That might be a bigger sell to families rather than a, hey, we're gonna bring you in for a lecture. In any kind of marketing or headline writing, you would say 10 tips to balance your technology for communication or something like that.
Balance. Yeah, balance. Okay, so we have up there, understanding the positive and negative impacts of technology and using it to communicate effectively.
Take understanding and put balance.
Balance. Balance the positive and negative impacts of technology and using it to communicate effectively. I see some head nods. We have head nods on Zoom or thumbs up.
I like that. When I think of using technology, I think it's multifaceted, right? Because you can use it to communicate with your clients, your parents of your children, and you can use it to increase positive, technology understanding of children at some point, at whatever is appropriate for the age level.
Thank you, Amanda. All right, 1 or 2 things we could do in the next 6 months.
Find research to put those tips together.
Is there another one?
I think finding the ways to effectively communicate that as well. So
I
some of us
agree.
know, but we're not necessarily reaching.
That's why I said earlier, like, I am a very black and white person, so when I see numbers or things like that, that really makes an impact on me, so I'm like, I would love to go to something like that. I know that screen time is bad, overused.
I had someone recently, I mean, this is probably a little severe, but for me, it was like, and I'm in early childhood, but they said it's like, it produces the same chemical in your brain as meth.
Yeah. That's what I mean, things like that impacts me, like
And what
more
they-
so than.
Yes, but what they told me is, they're like, take the small screens away. I'm not saying take screens away. They can still watch TV. They can still play their Xbox, but it's further away. It's bigger. It's not so much in your face.
One idea that might be a fun idea is, as we get close to Christmas, thinking about having a resource come in to talk about toys that promote learning and that are age appropriate versus toys that don't. Something that's simple, that you're gonna shop anyway, you wanna spend money now on things that are not gonna be detrimental. One of the speakers that we used actually spoke with the Hasbro product developers and shared her research, and after that meeting, the developers were really interested in what she had to say. The CEO said to her privately, at the end of the day, we use parent focus groups. This is not a nonprofit. So parents think they're buying toys that are educational because educational is on the label, and they're not at all. They're dangerous. So that might be interesting. That it's not so good, bad, what you're doing wrong. It's really, as a consumer, how do you make a good choice for your child? That's one idea. So that's something that would be doable in the next 6 months.
I think what else is helpful is showcasing what they should be doing, right? So yeah, I think a lot of them get a lot of shame probably anyway, or have internalized messaging already. So just getting more ideas or tips would be helpful. I also think that we're a couple generations almost away from people knowing what else to do without phones. Like you think of an 18-year-old with a baby, they've probably only ever seen mom shove a phone in front of a baby, whereas our parents weren't doing that. So do they even know what that looks like? Yeah.
Okay, time check, 2 o'clock. Readers, what would you like to do? Do you want to continue? It looks like we're doing one about every 10 minutes. It would take us 20 minutes maybe to get to 2 more, or we do the next 2 next month and then prioritize.
I was gonna say, I'd like to hear from the group, so I understand.
I have the 15 minutes, but that's just me. Would you guys rather have another at the next meeting? I'd rather finish this. Are those of you that have to leave, are you okay with the rest of the
share your input.
I shared my input on the speaker.
I did not tell them. Maybe the prioritization should be shared with the full group. Once you guys get through the list, if people are able to stay another 20-30 minutes, we can hammer through it, and then we'll prioritize the people who are present and then make sure that the others who are not here get a chance to also prioritize. Would that work? Okay.
So don't feel guilty if you step out.
Yeah, if you need to leave,
Thank you for coming.
feel free to leave. And again, these are all in draft. There's still many conversations to come. Shared connection around mental health and difficult behaviors. The man behind the curtain has got you, so throw out a draft. What kind of shared connection are we talking about?
I'm just thinking managing mental well-being for children and families. I'll go.
Well, and I think behavior, difficult behavior especially, is how I see kids communicate when they don't know how to communicate. I don't know what to do, so I'm going to do this. So I don't know how that fits.
We would go back to the social emotional learning how to play nice with others. I don't know how you want to word that, but.
But we can give them the social emotional learning like we do. But they'll know how to do that when they're in the building, but when they go home, it's a totally different environment, a totally different animal for them. And so my kids, I look at them as survivors, and sometimes what their behavior is a survival tactic. So how do we do that?
I was gonna share too, Jason, I think the social emotional, that's huge, right? That's the prevention piece, but then we're also gonna have some kiddos that are gonna need a little bit more than just that. And understanding that that's also part of prevention. Like if we don't catch all of those kids, then how do we prevent them to go deeper into the system or deeper into some of these problem behaviors or difficult behaviors? So
Well,
I
and
think
then at some point, passing that along to their children.
What about more of like encouraging and modeling? I'm sorry.
No, you're fine. Go ahead.
Modeling them.
Encouraging and modeling mental well-being for children, families, and adults.
And modeling how to communicate with difficult behaviors, because I think that's a big deal. I don't know.
So learning and modeling.
I think we're talking about two things here. We're talking about prevention. And I think this is more, maybe that's that mental health. But if you start looking at the comments that were under here, they're responses to difficult behaviors. In other words, the problems from birth to 5, 16 to 17, difficult behaviors.
Getting more referrals and services can handle system involvement due to mental health, no warm center for help before full-blown crisis, or some of the things that you prioritize.
I think some difficult behaviors are developmentally appropriate, like biting them. And kids are being exposed, they're being sent home for biting. And it's completely normal at the age of whatever, 18 months.
Full expression. It's the way you communicate. Yeah. So how might you change that? Or do you like the wording? Does it fit there?
Oh, no, it's a dumb pediatrician, when I add my 2 cents. When you go through, and Jason went through, and I don't know if any other teachers or teachers in the room, but when you went through your training, you didn't have very much time spent on Johnny that's just tearing up your classroom. So we've got to do a better job, even at the preschool level, of teaching people how to deal with difficult behaviors, including the parents.
Like self-regulating or someone else's difficult?
I
mean,
think this child now is in preschool or in the classroom or at home. How do we deal with those difficult behaviors?
And all too often, I think it's, we jump to sending them away, like. And I might be slightly jaded because of my profession, but a lot of times that's the response is to, regardless if it's school or childcare or whatever. I have my middle child is quite strong-willed, and he went to his daycare center, and there was probably 3 times in the 3-4 years that he was there that I had to go get him, and I'm like, and he's perfectly fine, and I'm like.
So I think that speaks to your point. I think it's both self-regulation and regulation of the child. I think part of what we've seen in the childcare world is that the provider's window of tolerance is narrow. They're exhausted and they're burned out. And so we're seeing more children expelled from childcare. And I think it's a balance between, and I'm sure you guys have too, we have childcare providers say nothing works that's working for. So there's a toolkit but it's going to continue to be an issue.
It always will be an issue. We're never going to solve it, but we have to have a response to improve. Because if you take Johnny and he's dealt with this way in preschool and it's inappropriate, the way that it's dealt with, or it's dealt with at home. And I saw numerous parents in the office. I mean, I can see you smiling, and it's how they deal with the problem. It's just like, what are you doing?
It all comes back to relationships and for those with those behaviors, like it comes down to having a strong relationship with someone else where they feel safe, that they feel that they can help them recognize those feelings they have, because like she just whispered, like behavior is a communication to an unmet need. And so it's really getting adults and the people around to help understand that that's a communication. And so we have to have the relationship, the trust to be able to manage those difficult behaviors so that child can effectively move through it.
I'm gonna add just a couple of things. One, I'm curious if we still, I saw quite a few behavioral health providers on Zoom, so I would like to just check in and see if they're in here and if they have an opportunity to share. And it looks like they're all, most of them are gone. So Jessica and Krista, I think they're kind of step away. So I'm curious to know what they would think. But two, just looking through this, and we're talking a lot about the early childhood piece, but I think when we're talking about youth and then adolescents too, because it's all different. But I heard you say a toolkit. So in my mind, it's a toolkit for some of those more problematic behaviors, but farther up the pyramid and problem behaviors for all ages. It's not just how are we communicating that at the early age, and then how are we communicating it a little older in life and identifying what that toolkit is. Is it a toolkit for the parents? Is it a toolkit for the kids?
I'm just gonna stop for just a second, because if we have an opportunity with this group to really think outside the box and to really think about Buffalo County, to me, it comes back to what, if we really want to impact this, it starts with helping families understand that the relationship and connection, and not just families, but everybody, so that it's on everybody's radar, that when we see, no matter what an age, the child, we automatically start thinking about where's that, we think about what relationships do they have, that's part of our assessment. And if that person, that child, no matter what age, doesn't have a relationship that's secure and attached, that should be part of our multidisciplinary approach. Because without that, I mean, and Jason, I'd love to know, because if you don't have a person, you don't have somebody to model or to reinforce, or so a toolkit is a great piece, but I would like to think even bigger about how we can influence a whole county of people to begin elevating the value and because again, down the road, I think that's how we can create more sustainable change. It'll require, it'll be a longer term effort, and it will require that family. I don't know. guys, we've been training toolkit. I mean, we have so many providers that have toolkits and they're just saying nothing is working. And we've got the COVID issue has impacted a generation that this is really an urgent.
And I would put building healthy, trusting relationships and connections.
I'm sorry, that doesn't really make it tighter. It's complex, I know.
And I grabbed what you said, but a little bit of Tana and what Alexander was saying, if it's some sort of toolkit or it's a toolkit navigation plan the community has, whatever that might be, to ensure all you have a connection to the caring adult or some sort of connection. So it kind of grounds us with where you're headed. This is big. This is a big.
We do that at school. Like we have a form the kids do that tells us who their trusted adult is. And if they don't have a trusted adult, then that's a kid that we work very hard to find that trusted adult for them. I think if we can do that in a bigger capacity, that might make a difference too.
Support networks. So taking what you are doing and building on that. I dropped it in so that you know their actions. All right.
I don't know if this fits in here, but I think in education for teachers at the elementary level, stop taking recess away from these kids with difficult behaviors. That's where they need to go and play. They need to be kids. Bring back recess.
And ice skates.
I'm gonna try and catch that. I know it's a
Bring back
significant what I put on
recess.
there. Education. So.
Thank you. If a child has to leave school for counseling, the school needs to be supportive of it.
We are.
Not all.
That's not always,
Yeah.
it's not always the case.
So who's doing it well and how do we build on that? Yeah.
And I think like you said earlier.
I would imagine where you're at, yes.
Yeah.
You might
Thank
be
you.
accessible.
Even when I was at Kearney High,
Okay. Well,
we,
elementary.
so, yeah.
It just depends on the day and the mood of the teacher.
It might, yeah.
What were you gonna say?
I was just gonna say appointments after 4 o'clock and telehealth options for kids. That would be really helpful.
Yeah.
I was a mental health therapist for 12 years before I did this role. And like, that is so idealistic, but so difficult.
Yeah.
Because,
So I think
It's
Medicaid
tough.
going into the next, Medicaid's out for RFP right now. We find out next Wednesday who the new contract providers will be. Hopefully we still have jobs. And I think telehealth is going to be into that. So for some Medicaid families, there may be some options. You know, if there aren't providers here, that we can connect them with telehealth providers in other areas. But
Other time zones.
I don't know about other time zones because of billing and paying claims, but there may be some expanded opportunities going forward for some of those low income.
Which actually totally shocked me.
I'm wondering if we need to invite the hospitals to our collaborative. Invite the hospitals, invite the people, the nurses.
Are there support groups?
No,
The
I
care
don't-
coordinator.
No.
The
The
provider.
people where the babies are born. Thank you. I can't think what I'm trying to say. I mean, what about, I know that there's social workers on units. What about invite, you have to do certain things before you leave the hospital.
Good.
And I think this might be a really good.
And I think I tried to grab it all, tried to capture it all, so we have it when we come back to it.
CRMC also is on steering. So, yeah, Travis Gregg and Abby also.
Matt Lohmeyer, we've got quite a few, there's just not here today. Accessibility, your shared statement, shared connection statement. Every child should have access to basic services. Basic need services, how do I want to say that?
Yeah.
Basic food, shelter,
Family or.
every family.
Every person.
Yeah.
Is it basic services?
Basic needs.
To
Needs.
meet their basic needs, the services to be.
Yes. I like that.
Yes, services to meet basic needs.
Basic needs, thank you. Thank you, Oz. I didn't really heard you, Oz. Any changes?
Well, that one was easy.
Good job, man.
All right, an action step or two in the first 6 months, what would you like to see happen?
How are we learning what basic needs people have? Are people self-reporting? Is it just through the intake forms that our agencies are getting?
We have some ideas on that, so that could be the first thing we could learn.
I would guess there's people we're missing who just out of pride or whatever would never say, you know, I have a need.
Is there a list of basic needs? What people think are basic needs? That might be a really good place to start. And all of those are basic needs, but there's other basic, yeah.
Transportation. Well, that's why I know internet.
Right, yeah.
Becoming a basic need.
That's good stuff. Very actionable. So finding out what people need, and then at least get us all on the same page of what's available. Seriously, that simple? Why haven't we done this before? All right, back to the leaders. I was gonna just ask, oh, go ahead.
Little bit on that, there's a lot of families that fall through cracks because of all the regulations and guidelines for different services that they have to meet. So I don't know if we can figure out a way of where's that safety net for all those families who don't qualify or don't.
Or that aren't legal.
Yeah.
You know, I've been dealing with a few that Medicaid is in need and not available.
We have some ideas on that. I'm so happy you have that as an action step. All right, show of hands. You get 2 votes, 5 items. 2 votes to vote on one of these 5. We're gonna have a prioritized list when we walk out of here. Is that correct, leadership group? Get 2 votes, and they're on the 5 topics. We don't have the 5 topics up on screen, which I suppose might have been helpful. So it is, I don't have complete sheets, so I can't even put that there.
I was like, what is that then?
That's what you're talking about. Surprise.
Do you want us to write our 2 topics?
Oh, I was just gonna do a show of hands, but we could write on cards.
Oh, I don't care. I see.
Does anybody feel?
Hands are faster.
Show of hands, number 1. Raise them high. Number 1, we're voting already. Don't miss the voting. We're voting. Number 1, you get 2 votes. Raise them high. So we can see.
I'm a leader.
13, Michelle, do you have them online?
Yeah, we have creative, or not creative arts, parent education and workforce are our votes.
Okay, thank you. All right, next one, workforce.
No.
Yeah, okay, give me another second. Stop. No, 1, 2, 3, 4, 5. 6. Okay, 6. Technology.
Whoa.
Technology. Did I see 1 in technology? Okay, mental health, difficult behaviors.
They're all important.
8. Access to basic needs.
I know. We don't have that. I know.
7.
I know. I don't know.
You have a pretty significant lead on the first one, that parent engagement piece. Compared to the others are pretty close tie, except for technology. Okay, we're not, I think probably what we need to say is that, this was just a prioritization list. We will bring this information forward to the next meeting for more conversation. And decide how we want to move forward. We really want you guys to process what's up here. I don't know, you guys can take over for now. I just was really trying to get what you wanted done in the time that you wanted it done. So I think we got there. Any other words you want for the team?
This, so then we can get on some action steps and really kind of narrow that focus, so. Appreciate everybody's input. Next meeting, September
28th, I think it's on your agenda.
saying that, yeah, the 28th. Jason, you're hosting it.
I would probably spend more time in the prioritized area and those action steps would be my assumption. Anything else from the staff team? Anything else from Zoom team?
Nope.
I have to assume that everybody feels like this was beneficial because you all stayed past 2 o'clock. Or just fun, but I mean, I would just be curious, did this feel?
And there are no cards again on the table for you to leave if you want to write something as far as a comment, but yeah, feel free with input for Natty's question. I felt like I pushed you guys really hard, but I see smiles today. Good job, guys. Well done. We'll get both of those who had to leave early.
You can't, they got big old